Urethroscopic applications. For urethroscopic applications, see page 203. Rectal medication. On account of its proximity to the posterior urethra, the rectum has always been a favored receptacle for drugs intended to benefit the urinary canal, especially when that channel was too acutely inflamed to permit local applications directly to it. Opium and antipyrine to relieve pain, and ichthyol and iodoform to reduce inflammation are the drugs in vogue. I have had no luck with any of them. Opium is more efficient when given by mouth or by hypodermic, and rectal irrigations of hot and cold water have proven much more efficacious than any chemical medication by this route, while massage, if permissible, is more efficacious still. Massage. The way to examine the prostate and seminal vesicles by rectal touch has been described in Chapter 1. Massage of these organs, to be intelligent, requires familiarity with their normal contour. The technique of massage is described on page 242. Antisepsis. Inasmuch as the prostate and vesicles may contain gonococci, the extension of which into the urethra is quite likely to set up acute urethritis or other bacteria that may cause a milder infection, as a general rule, the urethra should be flushed with some antiseptic after massage. The easiest way to accomplish this is by filling the bladder with potassium permanganate 1 to 3,000 or silver nitrate 1 to 5,000 before the massage, and instructing the patient to omit this afterwards. Installation of silver salts may also be employed. If the temper of the urethra is well known, the antisepsis may be omitted in certain cases. It is then better to have the patient retain some urine with which to flush the canal after massage. Irrigation. Rectal irrigation may be given either by a closed tube, the cycrophore, through which the water flows in and out, or by a double current tube. The former is a much neater instrument to use, but it does not impart so much heat or cold to the patient as does the double current tube. If no double current tube is to be had, Tuttle's apparatus may be employed. It consists of 2 large soft rubber catheters bound or sewed together side by side. The water flows in through one, out through the other. When the outlet is plugged with feces, the current is reversed. Of the special tubes, I find Chetwood's model, figure 44, more convenient than those of Kemp or Tuttle. Figure 44, Chetwood's tube for rectal irrigation. The patient fills a 2-quart douche bag, attaches it to the tube, hangs the bag so that its elevation above the outflow shall be about 2 feet, and greases the tube with Vaseline. He then seats himself toward the back of a privy seat, leans back against the wall, opens the cutoff of the douche bag until the water flows warm through the tube, and then inserts the tube into the rectum for about half its length. He then turns the water on and it flows into the rectum. If it does not return through the outflow, he stops the inflow as soon as the rectum feels full, pokes about with the tube until a gush of water announces that it is in the right position, then turns the water on again. It often takes from 4 to 8 attempts before the patient learns to do the trick neatly. The douche is usually employed once a day. The fluid is water at a temperature of 120 to 130 degrees Fahrenheit, as hot as the finger can bear. Exceptionally cold water, 50 degrees Fahrenheit, works better than hot.